Hello, and welcome to the Alabama Public Health Training Network. Thank you for joining us today for our program, Suicide, What We Need to Know. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the handouts, sign-in sheet, and evaluation are all available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for nurses, social workers, and EMS personnel for today's program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, continuing education credit will only be awarded for 1 year for nurses, expiring on May 31st, 2017, and 2 years for social workers and EMS, expiring on May 31st, 2018. If you are watching this program on demand and want to receive a social work continuing education certificate, then you will need to complete the social work test and send it in, along with your sign-in sheet and evaluation. If you are watching this program live, there is no social work test required. I'm Renee Carpenter, State Social Work Director for the Alabama Department of Public Health, and with me is Rebecca Jacobson, Resilience Program Manager with the Alabama National Guard. Welcome.
Hi. Today we want to talk a little bit about suicide as it begins to spike within our culture and not just in the military. And so we want to discuss a little bit on what, as professionals, we really need to know about it. We're going to look at some of the common triggers of suicide, look at some of the stressors, symptoms of compassion fatigue, because those of us who work within this field are not exempt from the very stressors that the people that we work with are. And so it's important that we want to take into account all the symptoms or professional fatigue that we can get as a result of working with various populations. We'll look at the warning signs of suicide and then different opportunities for action and training in response. When we look at some of the statistics, we want to think about that it's the 10th leading cause of death for Americans of all ages. However, when we start to look at the 15 to 24 age group, it jumps up to the second leading cause of death for Americans ages 15 to 24. And I would encourage you to look at the statistics in your own state or your own location, because you will find in some states for young people it has surpassed automobile accidents and other forms. So that would be contingent on your location, and you may be surprised by the statistics in your own area. Every day, over 100 Americans take their own life. It's tragic. If you've experienced it, if it's been a client, if it's been a family member, or it's been a friend. And we know, because it stays in the news, about the issues within the military. But even in the military, we want to reach out and consider families, friends, and we take the approach that one life that ends their own life is one too many. And so we want to build a network of caring and warm handoff. There are over 1 million suicide attempts annually. That's about one attempt every 31 seconds. These are probably not new statistics to those of you who work in the field and who deal with this. Men are 3 times more likely to complete a suicide than women, and women are 3 times more likely to attempt. You're probably, again, familiar with some of these statistics and realize that men often use more lethal means, and women often use a means that allows them to be found or an intervention to take place. So the intent, we can't measure that per se. It's just the method that would end the life. They don't keep the statistics, and again, this is, as professionals, we're all aware how long it takes to aggregate information and then evaluate and analyze that information. So we're looking at 2012, and we look at the number of reported suicides. Often when we train on this, we think of it as an iceberg, because we can count what we know, but we cannot count what we don't know. How many accidents, how many other forms of death that we're unsure of. I've worked with people in private practice who were grieving over they just did not know. And so we have a percentage that we know about, but we also have a percentage that we don't know about. And currently they're telling us that, 40 to 100 times greater than the number of suicides are the number of people who've attempted. So we have a cultural trend that seems to be on the increase. And I personally believe we can make a difference. It's a matter of noticing. It's a matter of being aware of what is going on. As a person who works with families and military folks and a variety of people who have to live beyond that explosion of pain that we call suicide, I often tell them, or I could probably say I always tell them, that no life is defined by the method or the moment of death. That a life should be defined by living. But our culture sees suicide with such a stigma that where is the support for those who have to live with this explosion of pain? And so I think as professionals in this field, that's where we can change the tide a little bit on helping reduce the stigma, talk about it, educate, and increase awareness so that those living, those left behind after this explosion of pain, will continue to reach out and get help and learn to live again a new normal, but also feel embraced that there's not a stigma because they've had a loved one who end their own life. A little more facts for you. Each instant of suicide or suicidal behavior can affect a few or large number of people. I often tell people suicide is an explosion of pain. So the individual who ended their own life had some form of pain they could no longer live with. It may have been a chronic physical pain. It may have been chronic illness. But it may have been chronic psychological pain. It may have been something that they thought they just could not go any further. They couldn't live with it anymore. It could also be 5 minutes of despair. And we'll talk about that as well. Because, again, so many people in the type of culture that we live in, when they encounter that 5 minutes of despair, they make a poor decision. That then is a final decision and a critical decision and a decision that affects everyone. Can't throw a pebble in a lake without those ripples being felt across the lake. Thoughts of suicide, again, when we look at data, how many people would report they're even thinking about suicide? As a professional in the field, how many people feel weird about asking the question? So if you have a client or a coworker or a friend that you know has been kind of, you think, do I want to ask them? And so we struggle with even discussing the topic with the living, let alone discussing the topic beyond death. And so it's really important. And you'll notice probably on this slide, Living Works Education is, they have applied suicide intervention skills training. They have a whole research program that supports their type of training. And so there are people moving and working and giving evidence-based practice behind this so that we can make a difference, and we can learn how to more efficiently deal with this topic that seems to make everyone, whether you're a provider or just a family friend, uneasy. Suicide facts in Alabama, when you pull up the statistics, 14.9 per 100,000, which is higher than the national rate. Why? I don't know. I don't have an answer to that. But it's double the homicide rate. And yet, when was the last time, other than this training or presentation, which as professionals we do all go and get to increase our own awareness, but how many people do you think know that? And if you're watching from another state, do you know your state numbers? How many people really pay attention to this until it is possibly a young person? Or it is, I believe, in the county where I live, in the past year, there was a 12-year-old who ended their own life and committed suicide. So that brought some attention. One of the reasons I'm passionate about it myself is that I have had 2 family members end their own life. And so one was a 12-year-old child. And so I want to talk about this and say, notice, pay attention. How much more important to ask that question than to leave our teens, our family, the people we care about, to face despair alone. Now, don't flip that to being guilty or looking at it as condemnation, because I truly believe I've had 5 minutes of despair, or felt overwhelmed, or probably everybody has, except I don't put that with a eternal decision. And so if you have someone that you loved and has ended their own life, it's about, let's make it a legacy for change, not about condemnation, not about you could have done something else. And so I'm very passionate about embracing this topic in a way that brings about a legacy of change. In 2013, this surprised me, 84 youth suicides in Alabama. Notice the youngest age on that is 10 years old. I think that's a moment of pause for reflection. 84. How many months are in a year? Okay, we only have 12 months in a year, right, folks? So when you think about that, how many children are dying each month as a result of suicide? We're the professionals. We know how to handle it. We need to speak up. We need to do something to make a difference. We need to understand what's going on. Talking about suicide is not easy. Training on suicide is not easy. But we still need to embrace it, and we need to increase awareness on the topic. Police suicides. I had a great opportunity to speak at the annual Chiefs Convention for police force law enforcement. You'll find out that, again, because many of us deal with these folks or in our everyday life, or have collegial relationships with them, or work with them, there is the national study of police suicides continue at a rate much higher than the number of police officers killed by felons. Law enforcement suicides, the last time they counted the numbers, were about 3 a week. And so I had a great opportunity again to share. But once again, we're looking at individuals like ourselves, they're professionals. And sometimes I say, we're kind of the garbage collectors in societies to some degree, because that's what we do. We help people handle a lot of problems. We help with a variety of things. But when we look at just police, we've covered what? Children in our state. That's devastating. Police, 3 a week. It reminds us we need to redouble, not just redouble, but we need to embrace the topic as the professionals. If the people who bring treatment, solutions, intervention are afraid to talk about this, who will? Why should someone else pick up the topic if we do not embrace it? So it's very important that we look at this. When you look at the police suicide rate, again, officers' minds on other problems, and this is what we often talk about as far as working with the military as well. We want them in their very best ability to focus on the mission and not be distracted. But at the same time, and as a provider who had a private practice at one time who focused on grief and trauma, we see a lot of things we just go, wow. And it takes a day to shake it. And we need to, build rapport, and we need to say, this was a tough day. I've never talked to a mama who's had a child of any age end their own life that is relieved, is right. It's not one that I forget, is not heartbroken, is not, beyond consolation. And so we all live with that when we're providers, when we intervene on the variety of ways that we deal with this. And so how much of it is still with you? And so we need to think about that as well. Frontline, not just police officers. Police officers are the ones that I pulled the stats for this, but to just show you in a variety of areas, it's not just the military. It's not just police. It's not just teens. This is spreading like an unnoticed epidemic in our culture. So there's a lot we need to do. Studies show that there are 125 to 150 police suicides a year. Okay, you can see the stats, 14 to 17 per 100,000. The public is 11 per 100,000, and the Army was 20 per 100,000. So probably everybody's heard about the military stats, but how many people have heard about law enforcement stats? Not even considered. This is 3 times the number of officers killed by felons. So we want to think about that. I want to back up just 1 minute, because when I did this presentation and was allowed to go down and present to nearly 400 chiefs in law enforcement, the average age for law enforcement suicides is in 40s to 50s. 15 years of experience. And so I think it's relevant that we understand, A, no one is exempt. And B, just because you've been in the profession a long time does not mean you're hard. You're hard to it. I got this. I've seen a lot of this. Counselors, sometimes we say that too. In order to be an effective counselor, we disconnect because we can't sit there and cry with our clients. Law enforcement, what makes them very good at their job, that disconnect, can also contribute to suicide because they are what? Disconnected. And so we have to think about that. The same thing with the military. What makes them very good at their job is their ability to what? Disconnect and be very focused on one thing. So I don't necessarily want to put everybody in one bucket and say, oh, reconnection is a problem. But if this is part of what you do, we have to ask ourselves, do we reconnect? How do we meet the needs of these law enforcement officers, of these people who have served us, of these people who lay down their life every day, and who see, in grief work, I hear a lot of stories, but I'm not seeing the body until maybe I go to the funeral or we go and, we're supporting someone. So we see the life side. But you think about the individuals who see the death side from the moment of death. And yeah, it's easy to say, I get hard to that, but by the same time, how do we soften back up? As providers, again, I think it's very important that we start to broaden our thinking on anyone could be affected by suicidal ideation. That we stop limiting it to mental health clients, to emotionally distraught, to just depressed people, and start to understand that, again, we're having a cultural shift on this topic, and as providers, we need to shift as well. So life is stressful. Okay, that's a picture of my kid. I love it. Don't think I put somebody else's kid up there. He'd probably go, great, Mom, you put me in a suicide presentation. How cool is that? But it is stressful. And you think about, apart from having a stressful profession, family expectations. What do you have to live up to? What are you supposed to be? What does society think you are? Has your professional image become so much of who you are that you're not connected, that you don't have that group of people that you can say, this day was not good, you know? No, I got it, you know? So family expectations. Do you shift gears? And again, we'll talk on this in a little bit, but how do you end your day? I just want you to think about that. Are you still wrapped up in work? Are you still feeling, thinking, and emoting work on your ride home? Or have you learned to put work at work and go home? And so we have to think about that. Relationships, they're not easy any way you slice it. Okay, it's just, if you're in a relationship, as a counselor, we often say, here's the cycle of a relationship. Going into a problem, being in the middle of a problem, or coming out of a problem. And that's pretty much what a relationship is. So there's a whole different level of stress that comes with trying to manage relationships. Friends. Now, friends, there's a variety of level of friends. Now, I have close friends who've known me for 25 years. I have friends that I've worked with for a long time. And I have acquaintances who I'll stop and say, hey, how you doing? Right, but we're probably not going to have dinner. But, you know, those kind of things. So we have all these levels of friends that we manage. Now, I would like to say this, and I would hope that I am learning to do this, that I will take the time to notice, even if it's an acquaintance who's off their game. I would hope that at work I would take the time to stop and say, hey, you're not yourself today. Everything okay? You know, what can I do to help? Can I listen? You know, those kind of things. When we think about teens, and the reason I put them up there is because, hey, I'm old and I need a reminder, okay? But when we think about teens, the reality is this, that their expectations of all these things have been set so high above normal. So we have the imaginary audience, everyone knows. And then we have the for real social media audience. Everyone knows instantly. And so we think about how that can factor into a teen's perception of their worldview or of how the magnitude of something that's gone wrong. Sports. Everyone has to be good at something. Is it okay to be a C average student? You know, when you just think about that for a minute, why isn't a C a good enough grade? Because we all go, A's and B's, those are good grades. Why isn't a C a good enough grade? Because there's other research. Gardner did research on 7 types of intelligence. Our current educational system, look, don't be offended. I'm an academic, so I'm not trying to hurt nobody's feelings. But the reality is our current academic system measures about 3 of those. And so you think about those creatively gifted children who can paint, who can express through music, who can capture something and put it together with Legos because in their mind they can see it. How do we measure that in school? With a C, you know, because the reality is we don't have. And I understand funding, and I understand administration, and I understand we cannot be all things to everyone. But the reality is, if 95% of children are gifted in some form, if you look at Gardner's 7 types of intelligence, and the current system that they go to every day is only measuring 3, how many kids are we leaving out? And allowing them to say, this is amazing. This is amazing. You can take this, think up something in your mind, and put it together. or be very creative or those kind of things. And so it creates even more stress for those children who are hands-on, for those children who are a different type of learner than what our system addresses. Stress outcomes, and this came from the reserves, made an excellent presentation, and I'm grateful they let me use this. They said, go ahead, Doc, any life you can change. We're all about changing lives. So I want to give a shout out for the Family Readiness Division who does that. But we think about, and they give a nice example of a tree bending in the wind. Okay, we have common stress reactions. They're temporary, they create mild distress, we can't think maybe, or that's all we can think about, or those kind of things, but it becomes self-correcting. So we focus on it until we have that, that's what I'll do, okay, I got this. All right, so we bend with it. Now, we might lay awake one night, and, still, we're just mulling it over. It seems to be how the mind works. And so that is a reaction versus an injury, because we respond, we have stressful hike in, thinking and physical and emotional, we have some changes, but we do eventually find within ourselves an aha or a coping skill that's going to deal with it. A stress injury, and like I said, I do think this is a great analogy, is a broken limb versus a bending limb. They're less common, but they might leave a scar. And you think about, since here in Alabama, we live in 2 tornado seasons a year, okay? Now, we hear the sirens go off, and we're probably going to what? Bend, because we're accustomed to it. It's not going to cause permanent, it's probably caused permanent change, okay? Reality, for you folks that don't live around tornadoes, most of us just, boom, we do what we're supposed to do. You hear the siren, we know. We kind of know what to do and how to do it, and we respect the siren, kind of thing. But if you've ever lived through a tornado taking out your house, if you've lived through that tornado taking somebody that you loved, turning your car upside down, those kind of things, then you're going to have what? Now, yeah, a limb's going to break, tree's not dead. That's not the idea. It's just an understanding that, can you undo that? I like to talk about it as cognitive shift, and I often describe cognitive shift as this. So before you were ever married or in a long-term relationship, you had plenty of ideas of how it was going to be. Then you signed the papers or made the commitment, and guess what? It's different. Not exactly how I thought it was going to be. Now, you can go your separate ways, but do you ever think the way you did before that relationship? Right? You had a cognitive shift. So you were betrayed, or you got some kind of stabbed in the back or whatever, and you now what? Think differently. And so trauma, and often I talk about, because people ask me, is that PTSD? And I don't want to go down that road per se, except to tell you that life changes us. As we go through life and we encounter things, life changes us. And so we probably all have the snapshot memory of 9/11. Because when I say that, September 11th, it brings up memories. It does not mean you have PTSD. But we had a shift in our culture, and we will never go back to the way it was before 9/11. Does that mean our entire country has PTSD or that we're broken? Or no, it's just a cognitive shift. It's just a response to an environment. And so that's kind of what we're talking about when we talk about stress injuries. So we need to be aware that because something didn't necessarily change me in the same way that it might have changed you or people that you love, there are people who have stress injuries or scars, or really had to take some time in that process of healing. And so those are some of the things we may not notice because we recover faster. And we need to think about that with our colleagues. My colleague might not be responding the same way I am. My colleague might have something going on at home. My colleague may have been down this road before. You know, in my own personal family, I've stood by the coffins of 3 of our family's children. That changed me. Okay, that did. And so one of them, as I told you, was a 12-year-old that hung himself when his parents were getting divorced. Okay, that child had 4 siblings, but that child was distraught by that divorce. And we say, you know, children, lots of children, not every child that's going through divorce will get divorced again. You know, I'm just trying to use an example that that particular child, that was a breaking point for the child. And it wasn't noticed because divorce is a common thing. And people recover from it and they move on and people are resilient. But that child wasn't, and no one noticed. And then I've had 10 years apart, 20-year-old nieces, one lived with me, that were killed by drunk drivers. Okay, they were on their way back from church. And so, as we all know in this profession, life is not fair. And so, both were killed 10 years apart by drunk drivers. That changes me. And so I have to be aware of that. When my own children learn to drive, again, I was just a wreck, okay? I was like, I wanted to be in the car following them around. Like, what good would that do? But, you know, that was still my temptation. But that was my issue. That was my scar from having seen 2 of our family members killed by drunk drivers. And so I think in this profession, we are so well-trained in categories and well-trained in identifying things that we sometimes forget that it might not fit a category. This person might have something we don't know about that has somehow changed and caused a shift in that. In other, I guess in another way to look at it, because I'm also all about resilience, I'm very effective at what I do because of those things. So it's kind of like a coin. I would never, ever want to go through them again. But they're very empowering to notice, to touch lives, to speak out, to be able to clearly look at somebody and say, are you thinking about suicide? You know, and so we have to recognize that, and I think that's some of the things that sometimes we're so busy trying to figure out the categories, trying to figure out the textbooks. When I taught at the university, I used to tell people all the time that counseling, because I'm both a psychologist and a counselor and a play therapist, that academics is like learning to cook. You got to know all the recipes. And then working in the field is like eating the soup and trying to figure out what's in it. So without knowing all the recipes and out knowing all the, you know, all the stuff that we all have to learn, the books, the DSM, the diagnosis, the categories, all that is very important, because when we get to the soup, if we don't know how to cook it, we're never going to figure out what's in it. But by the same token, when you're out there, if you're trying to make every recipe fit the book, you might miss something, okay? And so it's kind of, that's kind of the approach that I take. Sources of stress. I love this in not just in the way they laid it out, but I like to think holistically. And so when we consider every individual as being physical, intellectual, emotional, social, and spiritual, and often, because I give a lot of briefs on this, spiritual, and when we talk about that, it's not religious. It is the purpose for living. It is a deeper meaning for what you do. So don't just leave it stuck in a kind of religious box, as opposed to thinking about at purpose and meaning. And so when you think about this for a minute, because I'm not going to read the slide. If you were hoping I was, hey, you can read the slide and ignore me. How about that? But the reality is this, that if you physically hurt, it's going to pull from all the other things. So if I'm in chronic pain, my back hurts, my leg hurts, whatever, I'm really not going to be able to focus on a book especially an academic book. I'm not going to be able to focus on an academic book. Emotionally, what am I going to do? Most of us know. I'm going to snap at people, right? My emotional regulation is going to be out of whack because my physical has taken that as well. Socially, am I going to be out and about getting connected with people? Oh, I just want to show up today and let you know my back is really hurting. Can we hang out? No, that's not going to happen. And so it pulls. And then I often, now I jokingly say this, so again, I don't be offended, but I use a lot of humor because, hey, I think it's funny. That's probably not the time I'm going to be saying, let me pray for you, right? I might be saying, pray for me, I can't move, you know, something like that. But you think about all of our aspects of our personality can be pulled to any one of these. If you have a social situation going on and you're unhappy at work, guess what happens, right? All those other things get pulled away. You're not going to sleep. You're not going to be able to. And so you can pick any one of these areas and really think about how that can pull all the other areas out of whack. So the worst suicide funeral that I ever attended was that of a minister who killed himself. Now, I know what all the statistics says, right? That religious folks, they don't commit suicide. But this one did, and he was a youth minister. And his parents were military folks, big, strong, respected, wonderful folks who needed to be carried behind that coffin because they were so broken. But by the same token, do you see how any one of these other things that were going on would what? Pull our spiritual component out of whack as well? And so oftentimes, that's really some of the hardest things that people deal with, and we have some great discussions when we do training, and hopefully you will figure out how to begin sharing this type of training or information. But don't be afraid to talk about the spiritual. And yes, somebody's going to say suicide is sin. Be prepared for that. Let them talk about it. You know, understand. Well, I understand that that is your belief system. But you know, when you kind of look at this model, that can be pulled out of whack too. Because even if you have an argument with your significant other, whoever they are, you're not really feeling like praying, are you? Even if you're a religious person. So, you know, it's just a reality that we have to think holistically that these can be pulled, any one of these. So if somebody's emotionally distraught, if they're overwhelmed, it can be pulled out of whack. And instead of just saying, well, you know, they go to my church, they'll never kill themselves. We have to be prepared that in all these aspects of our life, we have to notice. We have to notice people. And not buy into, you know, some of this person will never kill themselves. So this again comes from the Family Readiness Group. They've made some of these to help us as we do training. So thinking not just about the type of stress, but how long is the stress. So if the glass is half empty or half full, and you have to hold it out here for 3 hours, the question really isn't, is the glass half empty or full? How long you got to carry it? Okay, that's what the question is going to be. So not just when we look at this, how long have they been carrying this? And you think about some of the things that go unresolved that maybe are not a big problem. Now, again, I draw from my own background in trauma and grief counseling. Our culture, and we kind of, I don't know, we're just probably not the best at this. But our culture, after somebody dies, gives us 6 weeks. Okay? When you coming back to work? Look, you got to get out of the house. However, those who've suffered this kind of loss have an entire year of mechanical living until the death date rolls back around. And then grief really begins. Because what we forget is they have to experience Christmas, Mother's Day, Dad's Day, the family reunion. All of these components have to go on for an entire year. And so once again, in the face of the family, somebody is missing. And when you think about death by suicide and you think about reactions after a death. So two of my nieces were killed in automobile accidents by drunk drivers. So lots of people want to bring food over, and that's a great thing, right? And people are happy to comfort you. Oh, I remember Mel. This was my favorite thing about her. We loved her so much, those kind of things. And they'll bring stories, and they'll share stories, and they'll come around. You doing okay? Yeah, we miss her too. Now, you take that same 20-year-old or family member who's ended their own life. Where are those people? Right? Because the immediate question is not, and the immediate social response is not, I'm so sorry for your loss. It's, why? Why did they do that? And so on top of having this horrible tragedy, the family members and the significant individuals in their life are now faced with social judgment. Because clearly you should have known, right? Well, what happened? How'd you miss that? People are not lining up to bring casseroles and comfort. And they're automatically feeling very judged. And so once again, we look at the method and moment of a death does not define the legacy of life. And we shouldn't let it. And so I don't know really how we can make that cultural shift. I'll have to tell you, in the last, even between the time I made this presentation and I gave this presentation last week, my sister from Michigan called me and said a young person that my kids went to school with committed suicide. Why do you think they did that? I said, whoa, first of all, your friend just lost a child. How about we back up to that? Because I really don't care why. Right now, what I care about is all the pain these people are feeling. Because we ask why for car accidents, but we really ask why did God let that happen, or why, or what was the bigger purpose. But when a suicide occurs, we ask the family, why? Why didn't you do something? Why didn't you see that? Why didn't anybody know? Why? And so we have to, again, we're the professionals in the field. We are the folks who are handling this. Where is change going to come from if we do not initiate the discussions and initiate the change? If we do not, beyond our professional life, say, whoa, how about we take them some food first? How about, and they said, what do I say? I say, you say a wonderful memory you had with them. You help create meaning. You say, you know what, I love this person, and man, I'm going to miss them. And here's the good things they brought to my life. And so that we rebuild that legacy based on life and not on the moment and the method of their death. And so when we look at that, we start to see, well, any of the first 5 that we talked about, the physical, intellectual, emotional, spiritual, those kind of things, can be little and go on a long time and become chronic. So when we look at this prolonged, the impact. Now, impact can be a traumatic injury. We're probably all pretty familiar with that type, and we kind of watch out for those kind of folks. But wear and tear, fatigue, this one kind of sneaks up on us. Do you know when you are starting to experience compassion fatigue? Are you really self-attuned and self-aware to know, you know what, I probably need to step away from this? And we'll talk about self-care and professional self-care. Loss. Grief is a funny thing because not only do they lose the individual in their life, they're now losing their support network because those folks don't know what to say. And so rather than show up and just be there, or like I said, bring a casserole or bring a memory, they stay away. So on top of having to grieve this loss, they now get isolated from the community. Or they don't go back to whatever their faith base is because now they feel, again, judged. And so then we end up with one of the Well, I don't really think any type of loss is more tragic than another, because if you've lost somebody, you have to live with that. And so that's what I think as professionals we need to do, is we need to help bring suicide back to a tragic loss that's equal to any other tragic loss. Is it greater? Is it less than? I don't think we can measure pain. Pain, particularly after the death of a loved one, is love that you have to carry and nobody's going to love you back. So often when I work with people, that's what I tell them. Okay, we have to figure out how to carry this pain, because you know what this pain is? This pain is all the love you had for that person. And so when my niece was killed in a car accident, and she was the primary caregiver, babysitter for my son, at 8 years old, he said, Mom, I know she's with Jesus, but I sure could use a hug. And began to sob uncontrollably. Now, no, she did not commit suicide. So that was a painful loss for him. But is this for the family? Can we measure pain? You know, when I'm doing live interactions, this is really hard for me. I just want to confess, it's really hard for me to sit here, okay? I'm a moving, doing, object relations kind of person. So it's like I'm 45 minutes into this, and I don't want to stand up and move away from this, but I'll get through it, okay? It's just a personal moment there. Sorry about that. But the reality is, when we think about that, how do you measure it? So if I had a candle here, and I usually have one, and I lit the candle and said, put your hand over it. What is going to happen to your hand? Yeah, she didn't want to do that, right? And I could bring up any race, any culture, anything, and say, put your hand over that candle. And what is going to happen? That person, leave your hand there long enough, it's going to burn. Now, it really doesn't matter how you experience that pain, or, you know, let's all sit here, burn our hand, and try and measure who's got the most pain. That's ridiculous, and I would hope you'd say that's ridiculous. But that's what we do with loss. We try and push people through this pain and let them know, man, in 6 weeks it should be over. You should be back on board. You should be, come on, get out of the house. Come on, you need to. And then when you put a suicide component that now has a social stigma and a personal level of questioning and undermining and taking apart and tearing apart the family. So we need to think about that. And why? Why is not a question I ask. My question of choice in counseling and just about anything is what? What are we going to do with this? How are we going to flip this coin? How are we going to make it better? Because why forces us to look backwards and live backwards and focus backwards, and what and how create. How can we turn this into a legacy? How can we measure the meaning in a valuable way? So you can see that. So when we look at those kind of things, I would say that suicide makes a different inner conflict than, look, when you're facing a crisis, when my niece, who was on her way, just been on a missions trip and come back, and she was killed by a drunk driver, I had a lot of questions. Okay, why? That wasn't fair, right? And so when that belief system is challenged, I made it, I'm okay, all right, we don't need an intervention after the video. But, you know, the reality is our beliefs really do get challenged. And then when someone ends their own life, this person is struggling with all kinds of inner conflict as well. And we have to think about helping them shift to the moment and method of death does not define this life. How they lived defined this life. And so that's just some components of things as professionals we need to consider. How do you check for stress? Another family readiness slide. But this one came again when we're looking just at military. But I think that this is very effective even for non-military. We have to listen and observe. Okay, so what were their normal reactions to stress? And then what changed as a result of whatever their chronic stressor or their lifelong stressor? What level of distress? Now, I can be irritable for a day, or I can live irritable. That's a different level. That's something that we notice that's changed. How do we ask? Do we ask about, hey, what's bothering you? And do we really have time to listen? We talk about that a lot, particularly in the military. When you're going to ask, you need to what? Listen. Have time to listen. So many of you, again, because you're professionals, you know this, but the idea is we got to train others. We got to train those non-professionals on how to notice and how to give a warm handoff. So notice the level of distress and then the effectiveness of functioning. Has their functioning changed? Sleep or lack of sleep, drinking, escalation, many of these things that you know about as well. But again, when we're talking about teens, how do you tell that teen that's been up all night gaming versus that teen that's distressed? I don't know, but I do think this, as we empower parents and family members and we talk about this, those folks will know. They know the difference. I know the difference between when my son is irritable because he's going to college, he's working a job, and he went out with his friends, then he's got a test due. You know, I know the difference between that and when he's really dragging. And that, you know, why don't you want to get out of bed, broke up with the girlfriend, those kind of things. And so it's important, just the idea that we think about these current stressors, how many are going on, the level of distress they're creating, whether it's chronic or whether there'll be a resolution, short resolution kind of thing, and then how does it affect the functioning. And you can do that through both observing and listening. And so even though we're not specifically talking about the military here, I think it's a good lesson for all of us in both professional and personal life. We can use that same kind of grid to check. Stress can lead to isolation. And that happens to a lot of us. So you might have a time that you pull back to think things through and resolve and come back out again. But when you pull back and pull back and pull back and you see your teen, I always had to knock on my boys' doors and say, hey, are you okay? Because teens will naturally kind of pull back. I did have to ask my own son at one time, and he'd been on some medication, wasn't really acting himself, and he said to me, he was 15 years old, and I went in, and he'd been kind of pulled back for about a week now, and I'm like, you know, this ain't sick, I've checked that, this ain't girlfriend, everything's okay there, I've checked the kind of regular parent stuff. So I knocked on his door, and I went in, and I said, are you doing okay? And he's like, I'm all right. And I said the question nobody wants to say, are you thinking about suicide? Now you're going, how can you just walk in and ask your son that? First of all, I knew my kid. I knew this was those things that were different. This was something that was not the same. I knew there was no really reason. I couldn't really pull a reason for this. And I knew that he was on a medicine that he had not taken before. And so he said, Mom, nobody would care if I was dead. Now I had the mom reaction, but I did not say it. Okay, I will say at least my training taught me something. You know, inside I'm going, you know, don't I care, that kind of stuff. And I just said, did the old counselor thing. Tell me more about that. You know, just tell me what's going on, man. Tell me more about that. Well, and then he began talking with me, and I said, well, let's just work through this. Okay, let's work through it together. You know, we might not come up for an answer right now, but you need to know we're going to go through this together. I also told him, you're taking some medicine. That might be changing things too. I'm not sure, but, you know, let's take time to check with the doctor and see if maybe that has caused some of this, and because this is just not like you. The next day, he was supposed to be somewhere, and he must have been 16 because he was just driving, and he had stopped, I don't know, like kids do somewhere, and probably 20 of his friends called him. Hey, man, where are you? You were supposed to be here, you know. So it was that just, you know, we got him through the tough time. We asked the question. We let him know there could be some other things going on. Let's just buy, you know, a little more together thing. And then the next day, probably 20 of his friends called him and he kind of chuckled about it then. And I said, see what a difference a day can make. You know, what you were feeling was real. I don't tell them, don't feel that way. Of course, you're professionals, you know that. We don't tell people how to feel. We acknowledge them and say, you know, let's work through this together kind of thing. But when we look at this, particularly if we focus on whether you're a professional, professional humiliation. Now, when I taught, I'm not perfect, so I'm cool with it, okay? I'm back against olden days. Yes, I'm old. I'm back against the chalkboard, and I'm going to get a white line across my, you know, posterior. So I would tell them that. I had this was probably one of my funniest because, hey, I don't expect life to be perfect, but one of my funniest events was I had somebody put some color in my hair, and it turned I Love Lucy red. So you couldn't do nothing about it. Had to wear the I Love Lucy red for a week because they said if you do anything, your hair's going to turn green. So you got two choices here. Stick with I Love Lucy red. Now, look, I usually do my hair because I taught on Tuesdays and Thursdays. So if I did it Thursday night, I had good, you know, time for it to kind of settle in and people not to notice. But let me tell you something. Tuesday I go in to teach. They noticed. I, by Tuesday, had completely forgotten. Didn't faze me. And I'm sitting there, and these people are looking at me, and I can't figure out why. I was like, did I unbutton my shirt? What? You know, what's going on? And they said, finally somebody said, Doc, your hair. And I died laughing, and I said, I completely forgot. You know, but you know what? And so we just laughed about it. But some people, that would be totally humiliating. They could never go out of the house. They couldn't. They'd be ashamed. There'd be all of that. And so what, to me, is laughter, because I'm not going to get from birth to death without doing a couple silly things here and there. I'm going to laugh about it. Hey, I'm happy to bring you a laugh about it as well. But other people would take that as what? Rejection and ridicule and humiliation, and I can't have a hair out of place. Failed relationships, we all know about. They're tough. It's not easy. The longer you've been with somebody, the longer it takes sometimes to recover from that. Drug or alcohol abuse, another one we've all been trained to look for. That avoiding friends or family. Again, you know, if I've just been to the family reunion and I got 5 sisters and 2 brothers, and the old man's got 6 sisters, and you know, we have like just huge amount of people. If I'm retreating for a week, that's normal. But again, know the people that you love, know the signs, the symptoms of avoidance. Exposure to trauma, this is a tricky one. What's traumatic for one person is not always traumatic for another. So it's what their trauma is. What has a loss of a dog or pet for an elderly person can bring on real despair. And so, you know, for other people, we'll say, it's just a dog, you know, or people who treat their pets like family. You know, again, family stressors, the sandwich generation, if you're caring for the elderly. And my own mom passed away from dementia, but she lived with dementia for 15 years. That was a long time to watch my mom slowly fade away into nothingness. You know, so that can be family history problems, suicide, mental health issues, or finances. And it's not just those things. Because again, if a family says, and in some of our training we do this, and I'm about to give you a break at the end of this slide, so just hang on for a quick minute here. If a family says suicide is wrong, and you're going to die and go to hell, that person is going to be less likely to tell someone they're thinking about suicide, right? Because they don't want anybody to know. Now, I personally, because I get this question all the time, if you talk to them about suicide, you'll give them the idea. And I say this, no. Can anybody convince you to commit suicide? Okay, seriously, if you came up to me and said, Doc, are you thinking about suicide? I'm not going to say, never have, but I have now. What kind of plan you got going on? You know, I mean, it's ridiculous, but that's a fear that a lot of people have, that if I ask or use this word suicide, I'm going to give people the idea. And oftentimes I say, no, you're simply going to uncover it. Because if the idea of suicide is already there, talking about it is not going to push them over the edge. Most people will be relieved that someone is willing to share this pain or discuss this pain. It is 2 o'clock, so...
Okay, well, we will go to a short break now, but I do want to remind our viewers, if you have questions for Dr. Jacobson, please feel free to call those in, or if you're not comfortable calling them in, you can always email them in. So we'll be back shortly. Welcome back. Thank you for joining us for our difficult topic, suicide, with Dr. Rebecca Jacobson. And I believe we have a couple of questions, so why don't we go ahead and take those now, and then we can continue with your presentation.
Sure.
The first question is, could Dr. J emphasize how marginalized groups are even more susceptible to suicide because of their isolation?
The question was about marginalized groups, if they're more susceptible based on isolation. It depends. Now, I know that's probably not the answer you want to hear. So some groups that are marginalized become more cohesive. And so sometimes you see, for example, lower SES kids that might go to college would form a club, and then they build based on their commonalities. And so I don't know, and I have not done the research to see if isolation can go both ways versus individual isolation. However, if I'm part of a unique group, whether it's socially unacceptable, but there's a whole group of us that are socially unacceptable, the group cohesion is probably going to impact whether they are more susceptible or not. If there's isolation within a group. Now, I was sharing on the break that I'm the youngest of 8 kids who was born in Baltimore, Maryland, to parents who were very poor. And so we lived in what we called row houses. I said people call them the projects now. So that's what I was raised in, and as the youngest of 8 kids. And this was a long time ago, y'all, okay? I was a white kid in an African-American neighborhood. And so I didn't know it. I didn't know I couldn't figure out why people were fighting. I couldn't figure out, that was in the early 60s in the race riots. I couldn't figure it out. So I had cohesion, even though I was in a marginalized community, inner city, but there was real cohesion. And so I didn't have an awareness, that I was poor. I didn't know I was poor till later on. Truthfully, I didn't. As a kid, I knew I didn't have the stuff other people had, but I had siblings and nobody in the neighborhood had it. So, those kind of things. So there was group cohesion. So I do think, kind of to flip the coin on that, and a takeaway is building group cohesion is very important to, even if it's an isolated or unique group, or I taught my own boys to embrace the nerd. Okay, we're nerds. We embrace it. My one son, who, he'll love me saying this, okay, I'm going to just tell you right now, he'll be dying laughing if he ever sees this, runs like Shrek. Okay, so he's flat-footed and he runs like Shrek, and we all knew it, and he was the last kid picked. So, but he was taking piano lessons at a local university at 12 years old. So we're all good at something. It goes back to what I talked about initially, that there are, 7 types of intelligence. There's all kinds of ways to be good. But I think if you identify something as being marginalized, how do we build group cohesion? Because that is going to be probably the issue that prevents isolation. And I hope that answers your question. And I'm not going to go down a research field that I haven't done just yet, but I do know the research shows that not necessarily, because if there's cohesion within a smaller group, then there's some real connectedness going on.
The next question. Can you talk a little about what we should be doing after a person has unsuccessfully attempted suicide and is returning home from the hospital? If you can't discuss it, can you recommend resources for the families?
Yeah, I would. That's kind of clinical advice, so I'm going to be real careful about that per se. But I do think getting them connected within the community is critical. And so we have a group called Joining Community Forces, or possibly a family guidance center, or your local mental health. Find the local resources, because some of the frustration is if you have to travel to get resources. And I would say this. If the family can get involved in resources, okay, it's going to help change the dynamic. I don't know what the dynamic was initially before anyone commits suicide or attempts suicide, but the dynamic needs to change. And so in play therapy, and when we work with groups and we talk about families, we use the example of the little mobile that hangs over a baby bed. If you pull one side of it, what happens? The whole thing is out of balance. And so since it's one individual who has attempted suicide, I deal with the family dynamic rather than focus per se on that individual. So finding those community resources that will help support the family, that again builds cohesion, rather than say this member needs treatment. It would be how do we work as a team? How do we get the family involved? And it's never easy. As an individual counselor, I've had those clients. Families are often angry, embarrassed, ashamed. There's a whole lot of negative family emotions that go around that, and that's why a family counselor or a family program can help with all of those. So that probably didn't answer your question, but that's as good as it gets for now. And I have resources at the end of the presentation. Any other questions?
Not at this moment.
Okay.
All right, go ahead.
Okay, we're going to move along then. And often this is one thing that I often present, because I have presented at high schools after there was a suicide in a high school. And when I start with that, whoops, let me go backwards a minute. And I start a lot with teen stress and some of these teen factors and talk about this road for both the teens and their parents. Isolation leads to despair. Okay, so if we look real quick, all of these things can lead, particularly a teen, but anybody, a professional, anybody else, will lead. That long-term stress, the chronic stress, or the traumatic stress can lead to isolation. Isolation then leads to despair. And a lot of times, everyone thinks. The individual, or even, as the question just talked about, the family, everyone thinks we did something wrong. Everyone thinks is a big factor in starting down that isolation road. Because if everyone thinks that, I can't go anywhere. I can't step out of the house. I can't do this. Teens, or again, I've met some adults that say this too, I never get included. Now, if you're a counselor, social worker, or any of you had your basic psychology, you know that always and never, when you start hearing people talk in absolutes. Okay, when I was being a mom, raising my kids, I'm still a mom, but they're grown. They just don't let me in their business like they used to. But anyhow, they were not allowed to say always and never, because there is never anything that always happens. And so I would tell them, we're throwing those words out. Those are not an option. And so I'm not good enough. How many people struggle? Probably every person. When a person goes through trauma and they've come into my office, I will often ask them Now, if you've been in my counseling class, you know that I've told you never ask a client why, but I will ask them this. Tell me why you think this happened. Because I really want to know what their self-blame, what they're saying inside their head. And a lot of times, because that's where we need, and it probably one of the saddest issues was I had a client who'd lost a child to death. And the client said, well, 50 years ago I had an abortion, and I think God is punishing me. So that's already in her head. I need to hear that. And I said, you think God had to wait 50 years? Or do you think maybe these aren't related? You know, because if you're going to go that road, that we're never going to get an answer to why. So the question is, what are we going to do with this? How's it going to make people stronger? What is the legacy that we're going to carry forward? That there is never, and I do not try and create or make up or console people with imaginary answers, folks, because they got to live it every day. And when you go to a house where a child has died, you have to live it every day. And so I'm simply going to empower them by talking about what we can do and how we can move forward on this. But when we look at teens, if we recognize these are common teenager thoughts, right? Everyone has those jeans. Everyone has those shoes. Everyone. Never. They always pick on me. I'm not good enough. What sends the message that we're not good enough? How did that ever get under our skin? Now, again, when I was teaching, I would have everyone in the class. This is a pretty big class, so I guess you can do it yourself if you want to. But I would say this. What is the thing about your body you need to change? What do you need to change about your body? Okay, in 2 seconds. In 2 seconds, they had an answer to that. Why do you need to change anything about your body? Why? You don't, right? But in 2 seconds, we can self-condemn. I mean, that's how quick and easy it is for adults to self-condemn. Oh, my hair's out of place. Hey, I haven't even looked in a mirror. So if you think I'm not looking good, you're probably right. But the reality is this. You know, a teen is living that 24/7 mirror. Everything's on me. Everyone's looking at me. Everything. So I asked them. I was in at a school where they had lost I believe was a 10th grader to suicide, and so they asked me to come give a brief in the lunchroom. So I'm in the lunchroom, and I was going over many of these same things that I've gone over with you, more in a kid fashion though. And I said the very question. So what's the one thing on your body today that everybody's noticing? So I didn't ask them to answer. I just told them to think for a minute. And I said, now, are you thinking about everybody else and what's wrong with them? Or are you thinking about you? So you've really spent the whole day thinking about this one thing. Your hair wasn't right. You have, you know, a pimple, something. And if you've spent the whole day thinking about that, everybody in this room is thinking about themselves. So if everybody in this room is thinking about themselves, this whole everyone thinks about me probably ain't happening. You know, and so we have to shift how they think. And they were like, that was an aha moment for those kids. It never occurred to them that everybody wasn't looking at them. So just helping them understand that. Our culture is instant. And one of the issues in our instant culture is instant gratification and instant despair. Because when you work for things, or when you had time to go home from school and fall on the couch and complain to your mom, and you got some feedback in between going back to face it again. But that picture on Snapchat or those, you know, technology has led our children to a place of instant despair where the people that love them, there's no time to get in there and counteract some of those things. And so some of it is speak to them. And again, if we help educate parents, if we help educate caregivers, if school teachers, now look, school teachers, my hat goes off to you. You are loaded. I get that. But by the same token, you're going to have a broken heart if you hear one of your kids have committed suicide. I tell people that all the time, and I've had these texts before, and I do not want the text, "Thank you so much for everything you've done, but I just can't make it another day." That is a horrible last word to get from anybody. Okay? When I've got them, fortunately, I've been able to intervene, but I know lots of people who haven't. I know somebody who left a cell phone video for mom. You know, those are some horrible, horrible things. And so when we look at this aftermath that you've mentioned, I want to get ahead of it. And so when we began, Applied Suicide Intervention Skills Training works. They have the research behind it. Living Works is the company that started it. I'm not trying to advertise per se. I'm just saying education works. And so if we're willing to step to the plate, and they were just really some of the first people who put an organized training together, it does make a difference. It builds intervention. It builds inoculation so that these kids know where to go and who to talk to. No one cares. No one will miss me. And that's exactly what my son said in his bad week. You know, we got him off the medicine. I will say that as well. But, you know, the reality is, if I hadn't banged on that door, who knows what I'd have found the next morning. I can't tell you because I'm a psychologist and a great mom, which I am, that, you know, my son, he could have been dead the next day. There's no exemption card for anybody on this topic. Despair leads to hopelessness, or it can, believing no one can help. All resources have been exhausted. Professionals get that way. You do know that psychologists and counselors usually have about a 5-year burnout rate, because we're supposed to be the helpers. And if I don't have the answers, can I go to my colleagues and say, I can't do this anymore? You know, when you think about it, do you have people? Now, I have 4 colleagues who are all counselors as well, licensed, and we meet once a month and just have lunch and detox. How you doing? We don't review cases. We don't make it a working lunch. It's how are you doing? Are you leaving the stuff at home? Are you leaving work at work, leaving home at home? These two things aren't getting mixed up, are they? I know you might be struggling with your kids, but is that going to work? You know, do you have your boundaries in place? What do you do for self-care? Are you self-attuned? Are you sitting there in that anxious situation feeling anxious? Or are you aware that, let me just take a breath here and focus? Or have you lost the ability to do that? That you're just geared 24/7? You don't understand? Yes, I do. I worked from home. I clearly understand boundaries. Now, I don't work from home now, but I did for several years. And I also had a private practice. So I understand that a person who comes to my office with a lifetime of problems is probably going to go home to a lifetime of problems. All right? They might have one new coping skill when they leave my office that they didn't have before. But I can't carry that responsibility that somehow I'm a miracle worker and a magician that can change life events. And I can't lay at night worrying about them, and I can't do the 24/7. No one can. And so when you think about that, if you are a counselor, licensed social worker, nurse, we're in a terminal profession. They call it a terminal profession because 24/7 we are that. But we have to turn it off. We have to be. Now, I was at home, minding my own business. I'm not going to be looking all doctory at home, okay? I'm going to be working in the yard looking like everybody else. And my mail person pulls up and says, "Are you a doctor?" And the first thing I want to say is, "No, she's not here." But I said, Well, it depends. What do you need? And so she said, well, there's this man down the street. She gave me the address. He said he was going to kill himself. Thank you very much. I'm at home working in the garden, y'all. Male person pulls up, tells me, gives me the address. I do not run down the street, y'all. Don't jump in my car. I simply pick up the phone and do what we're all supposed to do. My name's Dr. Rebecca Jacobson. I am a mandated reporter. Okay, the male person pulled in, said an individual at this address had a gun and was going to kill themselves. You need to do a safety check. Okay, I'm not going to run down there. I didn't get in my car. I didn't drive down the street. I did what? I put in place boundaries. I didn't follow up. I didn't find out later on. I saw the sheriff's car go down the street. And about a month later, when I was walking in the neighborhood, just for exercise purposes, somebody came up and said, did you know his family came and moved him out of this house? So it wasn't anything that I'd call, it's just that, you know, I took the appropriate action, I maintained the boundaries, and that saved a life. So you don't have to be all end all the time because you're going to burn out. So despair leads to hopelessness. Caregivers. Now, I have heard moms say this. I've heard moms say to me, my children would be better off without me. And I tell them, because when I was teaching, we did a class on personal death awareness, PDA. And I said, I have never, ever, in my 15 years of academics, found a student whose parent was gone that they were better off without him. I can tell you that right now. But a lot of times that, you know, back to that whole 5, you know, intellectual, physical, something has overwhelmed and pulled the person out of balance to where they actually think their child or their family or their friends would be better off without them. And so it's important to recognize now how rapid or slowly, you know, that you can go from isolation to despair to hopelessness. It's all going to be contingent on a variety of factors. And so I'm not trying to jump up here and give you another formula. You know what works for you. You know what you notice, and you know your own skill level. And so how do you tweak that so that you become aware and mostly promote awareness? Get those people who love them to notice. The most empowering thing we can do in the military is empower the families. Empower those first sergeants and the people that see them to say, hey, you're not yourself right now. And to ask that question, are you thinking of killing yourself? Now, when we do trainings, we don't say, are you thinking of hurting yourself? Because particularly somebody trained with a weapon said, nope, that gunshot won't hurt. So you can, if you ask the question, are you thinking of hurting yourself? Teens do not believe it's going to be hurt. They watch TV, people die and jump up all the time, right? When you look at the whole Piaget levels of thinking and development, and so teens don't really understand that it's going to be permanent. They'll tell you all the time, wait till you see, they're going to be so sad. You'll see all these people at my, well, that might all be true, but you'll be dead. And you won't see any of it. I didn't think of that. You know, those kind of, so they're limited in their thinking, particularly when you talk about teens. And so it's very important that you ask that specific question. Are you thinking of killing yourself? Committing suicide? Something that's clearly defined, because, again, if they're not, they're going to say, no, why'd you think that? And I ask this because people say, that's a hard question. I say, I know. Have you ever been mad at somebody that showed they cared about you? Have you ever? I really care about you. Well, get away from me. You know, I mean, we don't have that reaction when somebody cares about us and they're wrong. You know, it's more like relief. Well, thanks for caring, but you got that one wrong. You know, they're not going to never speak to you again because you simply ask them a question. And somehow in our world of professionals, that creates anxiety because we have to respond. So I have to tell you, and when I teach this, I tell them all the time, I say, you know, I always get that feeling, oh, I got to ask this question. I don't want the wrong answer. You know, I just always get that little bit of tense anxiety when I have to ask it. But I'm going to tell you something. That half second of intense anxiety or 5 seconds or 3 full minutes is better than dealing with a death by suicide. So push through it and go ahead and ask that question. Seeing death as the only means of eliminating pain. I often tell them it's an explosion of pain. There is also the elderly, you know, and particularly Vietnam vets. And you think about if you've suppressed pain and dealt with chronic pain for a long time, death might be the only means of ending that pain that you can see. I don't want to be on medicine. You'll hear military folks say that. Law enforcement, you know, lots of individuals that have some kind of security clearance or weapons do not want to take medicine. So they will see it as, I'd rather die than not be able to work. Because it's better for me to handle this than for me to deteriorate in front of the people that I love. So there's a variety of things to look at, but I tell them it's an explosion. So hopelessness can lead to death by suicide. It's the 10th leading cause of a death for Americans of all ages. It's just worth bringing this back around. I know that they're at the beginning of the presentation, but I just want to remind you, second leading cause of death for 15 to 24-year-olds. I have dealt with probably, now in the job that I do, we usually handle an intervention maybe once a week, and we track those. And apart from my job, since January, I have dealt with 5 civilian suicides. It's 1 a month. Okay, it's out there, it's everywhere, and so I'd much rather be doing trainings like this so that we can intervene rather than console the family. So just something to think about. A million suicide, one attempt every 31 seconds. And again, just a little reminder of our facts and why we're here to talk about this. Hopelessness is seen across, and you'll find these in a lot of suicide presentations, because again, these are, I guess, individuals of all ages, believing that all resources have been exhausted. I have tried everything. Now, when I saw clients, I said, here's how this works. I'm going to put a bunch of ideas on the table, and you take whatever works for you. So, if it doesn't work for you, you can come back and tell me. You have, it's okay. I don't have to be perfect. We don't have to come up with the solution, but I have a whole bunch of stuff we can try. So maybe one thing's not going to work, but we'll work together till we find it. Because if you give them 2 resources and neither resource works, then what's the idea? We've tried everything. And so I try and again think about, because we don't know who's suicidal until they are, right? So we work with a vulnerable population. And so we have to kind of, I approach it as every single person can hit 5 minutes of despair. Every single person is a person who could possibly commit suicide. There is no exemption card. And so when I deal with people, I try and now, instead of just thinking client versus non-client, I try and think of life is hard, people deal with stuff, I want to have a caring presence, and to kind of think about spreading information, resources, and awareness, because I don't know who's suicidal. I have no idea. I don't know who's at that moment, that breaking point. We can all pretty much see the trees bend. You live in a bad weather state, you can see those trees bend. Which one's going to break? And all the years that I have been doing this, and I already told you I'm old, but, you know, I have never been able to project a suicide. Oh, that tree is going to break right there. I can't do it for the weather, and I can't do it for clients, and I can't do it for people I love. So I have to what? I have to change my approach instead of thinking we can somehow identify that suicidal person, and instead build a safety net. And I do like the analogy of a net so that we can catch the people when they fall, because we don't know who is going to fall. Loss of control over self and others. Financial rewards for the family. Now, I throw that in there because, yes, a lot of people still think that life insurance does not pay when you commit suicide. But most life insurance have a 2-year rider, and they do pay. Military folks get paid. A lot of families get paid their insurance on the basis after suicide, after that well, it depends on the company. So this is not a financial consultant brief, y'all, but it's just to help you understand that, yes, it does pay. And so some people will see it if they're unemployed, if they've been downsized or put out of a job, that at least they'll get the insurance money. So we can't rule that out. That's also one that sometimes is, people are like, I just didn't see that coming. Okay? Well, tell me what was going on before. And then when you find out that, so some people will think that. Perspective. Now, we can have different perspective. I like this as well. When we think about our perspective, and I like to use the idea of a coin, what is individual perspective? Commitment versus alienation. So is there a link? We talked about, even if you're linked within a marginal group, or you're linked, there's a commitment, there's a link. I have only one, we've had one that was a murder-suicide, but if you go through all that you're aware of, and I have not done a statistical analysis or structured equation modeling or any of that stuff, so don't, think that it's research-based. But the ones that I have looked through, and most that I've read on, people commit suicide when they're alone. You rarely find anybody else in the house. You rarely find what? There's no connectedness. They're not saying, hey, I'm going in the other room and kill myself now, see ya. Right? So as long as they're connected. The ability to feel deeply involved in the activities of life. This goes away sometimes when people struggle with depression, but are they connected to the people they were connected to? You've heard the whole giving away things, wrapping up life. You're familiar with those. Control versus powerlessness. This is very important when we're looking at clients or doing, trying to figure out when we look at people, are they in a situation where they have no power? My uncle also committed suicide. He was 80 years old, and they were going to take his keys away. Now, all his life, he had told the family, I will not go to a nursing home. I will not give the money I have made to doctors. The money I have made in life will go to my family, and that's how I want it to be. And he went down early in the morning. Now, he ate breakfast down the road at this little restaurant with what we called the Dirty Dozen. So it was all a bunch of old dudes that would meet every morning for breakfast. And the Dirty Dozen began to die off from age and illness and everything. And so my uncle had company at the house, so another aunt and uncle were there with them. He walked down to go to his breakfast. He called the police and said an old man has killed himself behind this gas station, and he sat down and shot himself. And put the gun under his chin and killed himself. He had a piece of paper in his pocket with his name. He had no jewelry. He had made sure that there were family with his wife when all this occurred. That is how he chose to end his life. So he made a sacrifice for family so that they would get what he had earned for the family. He always said, I didn't want to give it to doctors. Right or wrong, I tell people all the time, if you're a faith-based person, it says it's appointed unto man once to die, and after that's the judgment. So I'm not passing judgment. I'm saying the man made a sacrifice for his family. because that's what he wanted to do. Control versus powerlessness. He felt everything was going to be taken away. He felt everything he had worked his whole life for was going to be given to people he didn't know. And he would much rather have that given to his family. So your belief, can you control or influence those events and experience? Sometimes control versus he had control over how he was going to end his life versus powerlessness of going into a situation where he felt everything was going to go away. Challenge versus threat. Is change exciting or is it demoralizing? And so sometimes that's one we don't think about as well. As changes come into our life, life is a river. It's a process of change. It is a variety of things. We don't have a lot of control. On the break, I was talking here and said, I approach life. You have two choices, to be an actor or a reactor. Those are the only two choices you have. Most of the bad things that happen to us in life, we don't get to choose. Most of them. Now, we've all done a few stupid things, and you know what? Consequences have never really been a big problem. I mean, if you think about it, I do something stupid, usually I laugh and understand, well, that was the consequences of my choice, right? Consequences don't always lead me to necessarily despair. Now, I know they can for some people. For me, they're not. But we forget that we might think a change is exciting, where another person might find it less, it's a sign of the end of life. I embrace aging. I think getting old is great, because every year there's something else I don't have to do, y'all. So, I reach the age I don't have to, all right? I don't have to jump out of the shower and answer the phone. They'll call back, all right? I don't have to check my phone for text messages when I'm driving. Who cares, right? I'll pull over. I'm at the age I don't have to, and I love it. But other people don't look at it as empowering, right? I had a wise mother-in-law who said, aging is about a young mind trapped in a body that betrays it. That's what it is. There's a lot of truth to that. But, the reality is, how do you approach that? Some people look at it as a loss, not a gain. And so that's important. Beliefs and values, they're different. That we don't just, we hear these words used together all the time. Beliefs are ideas that are held to be true. Some people have a belief system that is faith-based or spiritual, but again, spiritual values and faith-based don't always mean the same thing. Some people are purpose-driven. Some people are faith-based driven. So it's important to understand that that is not an exemption card. Too often we've been told that, faith, and they are a barrier. I'm not trying to downsize that or play that down or anything, but as professionals, we don't need to see the faith and the spiritual and the value card and say, gee, that don't matter anymore. They'll be good. They'll be good. They got their faith. Because that might not happen. They can be changed as a result of trauma. Again, if you think back to the 5 model, if something goes wrong, that faith or that spiritual can be pulled to the side. And so we have to think about that as well. I'm running out of time. There's a big surprise, right? Triggers for suicidal behavior, interpersonal losses, loss of self-esteem. Again, we've talked about all of these, legal difficulties, a way to get money. So, suicide of a friend or family member, sometimes that has a ripple effect, particularly in school. That's why it's good to talk about it rather than not talk about it, so that it doesn't create a myth or a mystique of some kind. Myths and facts. People who talk about suicide don't die by suicide. That's the fact is 80% have talked about it, and nobody listens anymore. They say that all the time. Talking about suicide will give someone an idea to do it. We've talked about that as well. No, that's not happening. All suicidal people are fully intent on dying and nothing can be done about it. Actually, 95% are undecided. If they're talking to somebody, they have a life force that is reaching out. If they're actually withdrawing and you see a lot of these signs, maybe it's nonverbal communication, they're giving signals of somebody reach out to me. Now, there are people that will, and again, I do not put blame. There's just people in that 5 minutes of despair in their life, and there was no one around in that 5 minutes to intervene, or they were totally intent. There was nothing that could be done about the way my uncle committed suicide. Didn't matter. There were people all around. He had made up his mind. Most suicides are carefully planned and thought about for weeks, and he had spent a lifetime thinking about how he would end his life. Suicidal people remain suicidal. That's why we call it 5 minutes of despair, to help you shift gears, that they're always going to be that way. Most suicidal persons are not mentally ill, right? Emotional distress is not the same as mental illness. 5 minutes of despair, chronic pain, there's all kinds of reasons that we don't need to buy into the myths. Stay calm. Now, we train this, and it's a great model. I tell people, look, when things are great, use them, right? Give credit. Of course, we're academics. We all know that, but use them. Stay calm. Don't leave the person alone. We teach triangulation all the time. They call me, stay with the person and call me. Then we have a triangle, right? Then I can be working to get some resources behind that. You can stay with the person and say, yeah, can I call your sister? Can I call some, to begin to build that support immediately, rather than ask the question, are you thinking of killing yourself? Are you thinking of suicide? Ask the question directly. And then we teach them, if they tell you, yes, I am, you don't need to say, don't do that. You need to stay with them and say, well, I'm here for you now, and that's it. Can we work through this together? Can you talk to me? Because if you get them talking, and if they're over here on the death side, kind of, or over here, I'm going to commit suicide, and you connect with them, now they're not alone. Tell me about that. Tell me what's going on. Let's just sit here and talk. What's happening to the person, right? They're moving away from isolation. They're moving towards connectedness. They're with you. If you talk to them and engage them, rather than just, don't do that. Let's go to the ER, rather than that, to say, again, and you're all professionals. You understand the difference between a clinical assessment and immediate action versus someone you care about or acquaintance or what, Are you thinking it? Buy time. Okay, that's why. You buy time by simply talking to them. I'm going to care. Let's talk about that. I'm going to be with you through this. Can we get somebody else in here? Those kind of things. And then the Ask Care Escort is the ACE card, the actual military that gives out. Ensure the person receives help. And so once you get them connected, they usually call. We have psychological health consultants. We have all kinds of resources. Then we connect them. We don't send them. We stay with them to what you all know is a warm handoff. Compassion fatigue. I just want to touch on this real quick, and then I'll open it up for questions again. We get this. The natural and consequent behaviors and emotions from knowing about trauma. If you're in this business, which I think most of you are subject to compassion fatigue. We all are. We shift away. I went to teaching. I had private practice. I did grief and trauma with little kiddos. Hey, I've seen some pretty tough stuff, but I built in colleague support. That's why the four of us went. That's why we checked on each other. Do you have support for you? Do you have someone in your network that you can say, man, this day, I can't shake it. This kid, I can't shake it. Do you have somebody that you can de-stress with, who understands? Because we can't take this home. It's not like you can go home and say, man, this was a horrible day, and you shouldn't. So, as professionals, we have to build networks to help each other out with this. Figley coined the term just so that you have the actual research behind it. Behavioral changes caregivers experience from indirect exposure to trauma, survivors, or the suffering person. Not just us, family members. And somebody had mentioned that. This whole family is going to have to go home. This whole family. We try and teach in the military, an individual does not have PTSD. A family does. An individual is not dealing with suicide. A family is. And so we need to shift to a broader model of meeting the needs of everyone. Likelihood of experiencing compassion fatigue is higher for those working with traumatized, and it will begin to disrupt your personal life, or you can't sleep. You're probably not going to tell nobody about this, okay? I'm a professional too. You ain't sharing this, and you need to be, okay? You're going home, that ride home from work, you're rehashing, you're rethinking, you're retraveling all the trauma you just dealt with. Even if it's chronic, even if it's little, even if it's just kids that are, oh man, they're heartbreakers, okay? It generates potential behaviors that can be disruptive. Intrusive secondary thoughts or memories, you can't shake them. You start to avoid your colleagues. You start to avoid people who might be saying, hey man, I know you've had a rough client, or that was a horrible accident you went to, or whatever, and you want to avoid people because I don't want to talk about it. I don't want to talk about it. We need to talk about it. Find a few colleagues and let's build collegial networks to help each other deal with this kind of thing. You start to lose sleep, you're irritable, you dissociate, and that's pulling away. You all know what that means, is that, I don't want to talk about it. No, I'm not. Sometimes you need to talk about it. Sometimes you just need to go, we would meet and oftentimes go get our nails done and just laugh and carry on. It's not, let's sit and discuss clients, right? It's debrief and check on each other. You may have anxiety, disconnection, avoiding the clients you don't want to see, the calls you don't want to take, the people that you're avoiding. Oh, please don't put that client on my roster today. You may be avoiding your therapeutic alliance if you work in some place. So these are things that you need to self-check, because our profession has suicide as well. Because when we hit hopelessness, we're already in the field. Who do we go to? You'd end your career, right? That's the first thing you're going to think. If you went to somebody and said, man, this got the best of me and I'm thinking about suicide. Everybody probably everybody watching this going, you suck the paint right off the wall. But the reality is we have to what? Start building that network and watching out for each other, because we see horrible stuff. We are the trash collectors, and we need to take care of ourselves as well. Gradual onset, defensive responses, psychological strain, you can't think, feelings that you're not making a difference anymore, that it's just a go through the motions kind of thing. Those with higher workloads, inadequate support, you feel like nobody in work understands, and then again you pull away and you get even less support. You get emotionally exhausted, and you just start going through the motions. And we've all been there. So there are days that you push through. So I'm not talking about that bad day where my kid might be failing and I got those kind of days where you push through. But if this is becoming the norm for you, you're cynical, you're dissatisfied, you don't believe in your profession anymore, then you're having symptoms of compassion fatigue. No trust, no those kind of things. And that leads to what we all know as burnout. So again, if we start watching each other, taking care of each other, what we do changes lives. It does keep people alive. We have seen in the military a reduction of suicides. When I worked for the Guard, it went from 3 a year down to 0. And, so we've seen that. Now we've also seen, that we've started taking it beyond just this works, so they found a model, they've addressed the issue, and we try and take it beyond so that it works. Secondary trauma, again, 15 to 18% of working police officers are having undiagnosed symptoms of PTSD, or really secondary trauma from what they see. So we want to think about that. Many who work in law enforcement, but our fields, our personal fields, we're exposed to secondary trauma and don't even think about it. We're socialized to be smart, strong. We triumph over adversity. We are the healers. We are the caregivers. We need to take care of ourselves. We need to gain resilience, understand the process of what this ambiguous loss or this compassion fatigue is, and learn to deal with it. Coping styles, again, that's probably a whole nother presentation, but if you're watching this, you probably know what they are. Use them, build them in. Autonomy and control, leave your work at work, build your home life. Believe it or not, my kids don't call me Dr. J, okay? They call me Mom. When I'm with my kids, I play the fool. When I'm in the yard, okay, I can do whatever I want to do because who I am and the drive for who I am is not what I do. Okay, it's about being, not about doing. So if I take care of Beck, if I take care of the being, I become empowered for doing. And I don't take responsibility for healing the world, for being 24/7 doctor, for having some kind of mystic presence that doesn't really exist, that I somehow have to be super mom and doc or whatever. So we have to be careful that creeps up on us. Supportive work environments, create one. If your work environment's not supportive, create one. Okay, there's ways to do that. Be the difference. And then find some sufficient resources. Resilience, the ability to grow and thrive in the face of challenges. So we make our challenges build our strength. Hardiness comes out of commitment, control, and challenge. We know how to balance those. And then as we learn to balance those, we become resilient because we know when to rest and restore and refresh, and we know when to give 200%. Identify your own strengths that need improvement. I always say weaknesses are just strengths that we have not taken care of, and so we need to take care of them. So when you see a weakness, you probably need to take a little bit of care of it and make it into a strength. And then build some goals. Identify the problem, get some help, and become proficient in buddy care. We need to have a battle buddy. How about that? I was like 3 minutes over, I think.
That's fine. Do we have any questions? We have no questions. Okay, well, thank you so much for joining us today, and I appreciate the information. I'm sure everybody else does too. And thank you all for joining us, and we'll see you next time on the Alabama Public Health Training Network.